are some questions about before the lung transplant. What age were you when you found out something was wrong with your body, and what were your symptoms?
Let's see, I was diagnosed with cystic fibrosis when I was 5 years old. And my symptoms were, I had a congested cough, shortness of breath, especially with exertion, exercise, and just having a lot of respiratory infections.
Do you know anyone in your family that had or has had cystic fibrosis?
Yes, I'm the youngest of 5 children, and I have 2 older brothers that have CF.
Are they still alive?
One of them died about 5 years ago when he was 50, and I have another brother who's 55 who's still alive.
What is he doing for his cystic fibrosis?
He has to go into the hospital probably 3-4 times a year for IV antibiotics to clean out his lungs.
How did the doctors treat you for this disorder? Please tell us a summary of your treatment.
I would say that as a child, my parents probably took me up to Children's Hospital in Boston, I'd say about 4 times a year. And I would have to have pulmonary functioning testing and chest x-rays just to find out, how I was doing from a pulmonary point of view. But overall, I had wonderful treatment from the physicians and the physical therapist at Children's Hospital, so I've been very pleased with my therapy.
These are some questions about the lung transplant.
How long did the lung transplant operation take?
It took 9 hours.
Did you immediately see a difference after the operation?
I did. I had a breathing tube inside of me, but once they took that out, I could breathe so much better. So I could tell pretty immediately.
Do you know the donor, and what does it feel like to know you have a donor's lungs?
I didn't know the donor. I had my transplant March 11, 2003, and my donor at the time was 63 years old. And I actually I wrote a letter to the family thanking them. So obviously I didn't meet anyone, and I tried to make contact, and sometimes families want to stay in contact and sometimes they don't.
These are some questions about life now after the transplant. Are you on a special diet? Do you take a certain kind of medicine?
I do. I take many medications. I take a couple of anti-rejection medications so that my new organs are not rejected by my body. I take a couple of antibiotics, lots of vitamins, and I've always taken a lot of medication with my CF, but I definitely take a lot of medication, and one of the most important things is to exercise. So I do exercise about 4 times a week.
Compared to when you had CF, how much more physical activity can you do, and what kinds? Is there anything you can't do?
I would say that I actually do a fair amount. A year after my transplant, I was in the transplant games, and I won the bronze medal for the 25K for cycling. So that was pretty exciting a year afterwards. And I actually have much more exercise tolerance. I ski, I do gymnastics. I love to exercise.
That's good.
Are there any chances of it recurring? Do you get checked for it?
Yes, I go twice a year to Brigham and Women's Hospital, and I'm checked out.
Thank you.
Thank you.
Thank you, girls.